Hello, my name is Lily. I am from Miami, Florida. I'm 31 years old and I was diagnosed with stage 4 low-grade serous ovarian cancer at age 28. I will say those symptoms and side effect or symptoms were very spot on,
Okay.
but the fact that they are so silent and normal things that could happen in daily life and be brushed off as another thing is really, I think, what led me to being diagnosed later
Mm.
than catching it earlier. I even had gone to an OBGYN and had a IUD inserted 3 months before I was diagnosed.
Mm.
I had a transvaginal ultrasound. I explained to the doctor that my mother is an ovarian cancer survivor and that I need to find out if there's a test that I could take.
Right.
And I was told that there was no test and just kind of brushed off because of my age.
My name is Emma. I'm 29 years old, and I was diagnosed with low grade serous ovarian cancer at the age of 26. Of course, there are so many ways to build a family in 2023, but this cancer has robbed me of the opportunity to experience any of those moments I have spent my whole life envisioning. While I was privileged enough to freeze my eggs in between surgeries, I will need a surrogate to carry our child, and the expenses of that are inordinate. While most couples my age are saving for things like a first house, their honeymoon, or a car, we save up hundreds of thousands of dollars to pay for a woman to carry our child in organs that I no longer have access to because of this cancer.
My name is Ellie. I'm 30 years old and I live in New Jersey with my husband and my two dogs. I was diagnosed with stage 3C low grade serous ovarian cancer in 2021 at the age of 27. Prior to my diagnosis, I had a variety of very vague symptoms that were dismissed by medical professionals, such as bloating, a sudden onset of pain during sex, and extreme fatigue. I now experience a new range of symptoms related to living with this disease. I would say that the most significant symptoms I have are everything that comes along with menopause and what my body has been through.
Hi, I'm Laura from England. I'm 37 years old and mother to Dylan, who was 13, and Amelia, who was 11. My journey with low-grade serous ovarian cancer started back in 2016 when I was diagnosed with stage 3C. This was discovered when I ended up in hospital with pain in my pelvis. The doctors originally thought this was down to my appendix, but a scan showed large ovarian cysts and later a biopsy showed cancer. Looking back, before my diagnosis, the first symptoms for me were severe lower back pain and discomfort in my pelvis and the bloating.
Yeah, it was sharp,
Yeah.
sharp episodes of back pain. And I'd have for like a week at a time. I
Oh
would
my goodness.
experience it and then it would go away for a month, go away for 2 months. I'd forget about it and then it'd come back.
Oh,
And that would last for about 2 to 3 years.
wow.
Little did I know that I had masses growing and a lot was on my colon and I have a colostomy now and life is looks a lot different for me now. But
Sure.
the lower back pain, now thinking about it, if I had all of those masses in there,
Right.
that's where that's coming from.
Yeah.
I was diagnosed when I was 19. It was my first year of college. So it was really overwhelming. And at the time, they told me the prognosis was like probably 10 years. So since then, it's just kind of been like countdown for me because it's scary to plan anything and then to not know if it's the 10 years or if it's less than that or if it's going to be more than that. So I don't know how to plan. I'm now in grad school and I have a job, but that was not possible for a very long time. Just this past year, I got a job, and just this past few years, I started grad school. And it's been really difficult with doctor's appointments, pain, concentrating on anything other than having cancer.
Yeah.
It's just a lot. Yeah.
Good morning. My name is Lisa. I lost my beautiful daughter Alexia to low-grade serous ovarian cancer 3 months ago. Yesterday would have been her 30th birthday. Although Alexia appeared to be the picture of health, looking back, she had recurring abdominal pains for much of her life, which had resulted in a cholecystectomy and a hospitalization for what we believed was IBS. The pains became more intolerable, and 2 years ago led her to the emergency department and an emergency ovarian cystectomy. Thankfully, a small single row of cells on the peritoneal wall was biopsied, leading to a diagnosis no one ever wants to hear.
I think my greatest worry is definitely the mortality issue, but it's kind of multifold. So I do worry about that. I have 2 young children, so I worry about leaving them. It's also difficult to talk about these topics. My husband is amazing and supportive and does the most. However, it is hard for him to talk about those things. So having some of those discussions are hard. I am grateful. I have 2 amazing girlfriends that are a voice of reason and listen to anything and support me. And I feel lucky in that, but I know that's not the case for everyone. And it does get hard to have some of those conversations.
Yeah, I definitely think that like dating and friendships have kind of taken like a back burner, not only because it's hard to participate in like meeting them and interacting, but also because it's like I don't want to hurt more people than I have to. If I was to not make it and I wasn't to survive from this, I don't want it to be a bigger blow to more people.
Wow.
I don't know if I'm going to have surgery next month or like anything could happen. And so that's really, really hard to kind of live with. And every day, I don't know what's going to happen tomorrow. What's like, am I going to wake up kind of thing? Because you're just constantly, I'm constantly feeling like there's something inside me growing and there's no way for me to stop it. And it's terrifying to not have any control.